I'm Angelica. I'm going to be doing a head-to-toe assessment today on my patient who's 2 days post-op for an appendectomy. And I'm going to start by coming into the room, and before anything I'm going to do my 60-second assessment. I'm going to make sure to check my patient for ABCs, make sure my patient's on any respiratory distress, circulation looks okay. And also going to check my emergency equipment and make sure I have my oxygen flow meter, my Christmas tree, my Yankar, my suction canister, and Appy bag in place. I'm going to check for any environmental hazards, any lines on the way, anything on the floor, or anything that could cause any danger or could be hazardous for my patient. Hi, I'm Angelica. I'm going to be your nurse today. I'm here to do a head-to-toe assessment, check your vitals. Can you verify your name and birth?
Living Mitchell, 12886.
Awesome, thank you. And how are you feeling today?
Okay.
Are you in any pain right now?
A little bit.
Okay, and a scale from 0 to 10, 10 being the worst pain of your life, what would you rate your pain?
Probably like a 2.
Okay, and what would you consider an acceptable level where you need medication?
About a 4.
About a 4. Okay. Is there a certain area?
Just where I got my surgery.
Okay, I'm going to take a quick look at it. Just going to put my gloves on first, just in case. And when does that, when do you feel the pain?
It's pretty constant since my surgery.
Okay.
Just sore.
Okay, I'm going to take a quick look. And I'm checking the patient's incision area for any signs and symptoms of infection, checking for any redness, exudate, extreme swelling, and I'm also going to check for temperature to see if it's hot, but I'm going to do that after I listen to my bowel sounds. So when I do my palpation, can you tell me, I'm going to raise the bed a little bit, okay? Can you tell me when was the last time you had your last bowel?
Today.
Okay, this morning?
Yes, this morning.
And how would you describe it? Was it normal? Was it diarrhea or
normal? Formed.
Brown?
Yeah.
Okay.
Big.
At this point, I'm gonna either have already done my vital signs, or I'm gonna perform my vital signs before continuing. Since my patient doesn't look like there's any infection or any problems, I'm gonna take a quick listen to your abdomen if that's okay. So I'm gonna check for bowel sounds. I want to listen for each quadrant for 15 to 30 seconds. I want to hear 5 to 7 sounds per quadrant. Have you been passing gas okay?
Yes.
Okay.
Be careful.
Okay. It's okay. So I'm going to listen to the right lower quadrant, and then right upper quadrant. I'm going to listen to the left upper quadrant and left lower quadrant. Now I'm going to palpate my patient's abdomen and check for any distension or tenderness from this. Let me know if you have any pain, okay?
Just a little tender.
Yeah, okay. And while I'm here, I'm going to go ahead and feel for the bladder and the distension. When was the last time you urinated?
This morning as well.
Okay, was there any odor, normal, any stinging, frequency?
No.
Okay,
It was normal.
Okay, awesome. Glad to hear that. So I'm just going to take a quick look at your head. I'm just checking for any bed sores or lumps, and I don't see anything looks good. Have you had any changes in vision, hearing,
No.
taste, smell?
No.
Any dizziness? I'm not sure if I just asked you that.
No.
Okay.
You didn't.
Okay. And before I move on, can you tell me where you're at right now?
I am at the hospital.
And what brought you here?
I had my appendix removed.
Okay. And
Now I'm gonna find the ID bag.
the month and year?
August 2023.
Okay. Okay. So should have done this at the beginning, but my patient is alert and awake times 4, and no speech impediment, and her behavior is normal. It's an acceptable behavior. So I'm I'm just gonna take a quick look at your eyes. And I'm checking for pupil size, if they're equal and round. And then I'm gonna shine a light. Just look straight at me. And I'm checking for reaction to light and consensual reflex as well on both sides. Okay, and then can I have you look at my pen? And look at the ceiling. Perfect, and I'm waiting for adaptation to distance. Or that works. Accommodation.
Same thing.
To distance.
Been adapted.
Okay, can I have you look over to your right and look over to your left? I'm looking for any jugular dissension and look at me, and I'm looking for any tracheal deviation. I'm gonna check for skin turner. Can I have you smile for me? And raise your brown. Okay, and then stick your tongue out. Okay, and say ah. Quick one, I'm just looking at your mouth for any like dry mouth or anything like that. Sores. Okay, I'm gonna listen to your heart. Have you had any chest pain, any palpitations? Are you taking any cardiac medication?
No.
Any shortness of breath?
No.
And any history of COPD?
No.
Okay, so I'm gonna take a quick listen to your heart and to your lungs, okay? And this normally would be in my ears. So I'm gonna listen to the right side, second intercostal space, sternal border. I'm listening to the aortic valve. And then I'm gonna listen to the second intercostal space, left sternal border, listening to the pulmonic valve. And then third intercostal space, sternal border, Erb's point, and fourth intercostal space, tricuspid, sternal border, tricuspid valve. Then I would move over to the fifth intercostal space, mid-clavicular line, and I would listen here for a minute for the apical pulse. I'm gonna move over to listen to the lungs, and I'm listening to the upper right lobe. I'm listening at the second intercostal space, mid-clavicular line, and then I'm gonna listen to the left upper lobe, second intercostal space, mid-clavicular line, and then I move down to the fourth intercostal space, mid-clavicular line for the left space. There's no lobe there, and then fourth intercostal space, mid-clavicular line to listen to the middle right lobe, and then I'm going to move down to the anterior axillary line, mid of the upper arm, listening to the right lower lobe, and same on the same side, middle of the upper arm, anterior axillary line, and I'm listening for plug sounds. Okay, I'm gonna listen to your lungs in the back, so I'm gonna have you turn over on your right side if that's okay. Can you do that for me? Thank you. And at this point, I'm gonna check and I'm gonna make sure I'm looking at the skin and check for the integrity of the skin to see if there's any beds, any pressure ulcers, and just to see the integrity. So now I'm gonna listen on all the bony prominences from head to toe. Listening to the lungs, I'm gonna start at the bottom. I'm gonna start at the inner spinal border for the left lower lung, at the middle of the upper arm, and then I'm gonna go spinal border in the middle of the upper arm, listening to the lower lung, lower lobe of the right lung, and then to the posterior axillary line, middle of the upper arm. I'm going to listen to the other side of the lower right lobe and left lower lobe, posterior axillary line, middle of the upper arm. I'm going to go on the underside of the scapula in the inner vertebral line, not on the bone, listening to the middle of the left area of the lungs, and then vertebral border in the underneath the scapula, not on the bone, listening to the right middle lobe, and then moving up over the scapula on the inner vertebral line, listening to the upper right lobe, and vertebral line over the scapula, not on the bottom. Okay, perfect. Thank you. Can I have you turn back? And now I'm just gonna go ahead and touch your extremities, and you let me know if you feel any pain, numbness, tingling when I touch. No, okay. So skin looks normal to her ethnicity. It's warm to touch and it's dry. Now I'm gonna feel for her radial pulses, and they're equal and bounding, and check for oh my gosh, I forgot this word.
Capillary refill.
Capillary refill. Can I have you squeeze my fingers? Okay, and can I have you pull my fingers towards you, push against? Okay, awesome, thank you. Now I'm gonna go ahead and move over to your legs, and can I have you lay them flat? Let me know if you feel any pain, numbness, or tingling. No, and I'm checking my patient's skin, and it looks normal to her ethnicity, warm to touch, and dry, no edema on either upper or extremity. I'm gonna check her capillary refill without the socks, and it's under 3 seconds. I'm also gonna check for pedal pulses, posterior tibialis, equal and bounding, and dorsalis pedis, equal and bounding. Can I have you push against my hands, and then point your toes up to the sky? Thank you. Okay. Do you have any questions for me?
No.
Do you have a good family support system at home?
Yes.
Okay, so you have plans for discharge?
Yes.
Okay, awesome. We're almost done with my assessment here. I'm just gonna lower your head, and I'm gonna put your call right here. Let me know if you need anything, okay?
Okay.
Thank you. What did I forget?